Hi, everyone, and thank you for joining us today for Enhancing Performance Management Techniques, How to Prepare for Performance Reporting. Before we get going, I just want to give a nod to the Office for Victims of Crime, who are sponsoring this presentation today, and mention that any of the thoughts, comments, and information you receive as a part of this webinar are those of the author and don't necessarily reflect the views of the Department of Justice, Office for Victims of Crime. Couple housekeeping rules for those of you who are new to this platform. If you could just stay on mute when you're not speaking, it really helps to cut down on background noise. And also rename your square if your name doesn't appear there. That helps us if you're asking a question, especially. Use the chat feature. If you do have a question, we'll keep our eye on that. And if you have any technical questions, please contact me. I'm Marty Washington at mwashington@ncall.us. And with that, I'm going to turn it over to today's speakers.
Hi, everyone. My name is Kristin Reel. I'm the Training and Technical Assistant Specialist for OVC PMT.
And hi, everyone. My name is Phillip Kim. I'm the Technical Assistance Program Coordinator for the National Center. So as a result of today's presentation, attendees will learn about performance measure reporting for the Office for Victims of Crime, including planning, preparing, tracking, identifying metrics, methods for collecting information. We'll also learn about tracking and reporting performance, and then some tools and functionalities that can support the work.
So I wanted to start today off by, again, my name is Kristin Reel. I'm joined today by my teammate Maribel, who will be happy to answer any questions that you have about the PMT specifically in the chat box. We're going to introduce the performance management team, talk about performance reporting, specific E-MDT measures, how to track and report performance, some tools and functionalities, and then we'll have time for questions and answers toward the end. Thank you. Okay, so our team has changed since the slide was updated, but our team lead is now Eric Smith. Our data analysts include Aubrey, Maribel, and James. I'm the TTA specialist, and we have our help desk support guru, Daniel Pavlik, and our systems guru, Liz Wayne. You can reach out to any of us to have any of your questions answered. There's a number of ways that we can support you during your sub-award life cycle. The first is, if you have any questions, feel free to contact us. That can be about any measure, how to use the PMT, or anything like that. You can always schedule an welcomes to the Office for Victims of Crime Performance Management or a performance measurement tool session for new staff. Consider a short 30-minute session via WebEx where we can screen share and then review your reports. Or you can send questions, comments, and suggestions for technical assistants to our help desk. We're going to move on to performance reporting. So let's dig into why OVC grant performance data is important. OVC performance data is super important. And the reason is because PMT is one way to see the bigger picture and show how your program is impacting your community with your funds. The Grant Performance and Results Act modernization, which was amended to the Grant Reporting Efficiency and Agreement Transparency Act, supports this focus.
Hey, Kristin, you might need to turn off your camera because your audio is really kind of breaking up. Let's try that a little bit. Thank you.
Sure. Is that better? Okay, perfect. Performance data is important. Where did I lose? I lost my spot. Because it shows us how your program is impacting your community with the funds that you're granted. This supports the focus in the federal government grantee performance over basic compliance with regulation. Legislation then reviews grantee performance through the quarterly reports from sub-grantees. Data is just one piece of the story. When we're looking at aggregate data for a program or across the nation, It helps if we're painting a compelling story of how many victims are being served and how they're being served. OVC uses that data that flows up to reach national level audience from Congress to the general public. Your work helps make these reports possible and the basis for the respected as OVC often sees through data requests from Congress and state governments. Grantees, though, use performance data to help assess and meet the needs of the population that's being served by enhancing needs assessments and action plans, aiding and monitoring the progress of grant goals, and identifying underserved populations and tailoring resources for clients. The data you currently collect to report in the PMT and Just Grants system is used to understand programmatic needs and expectations, define your approach to reaching the indicated goals, to analyze data, using the data collected and can help to reevaluate current activities and client needs. We can measure success without a formal program evaluation by implementing pre-established targets, comparing current outputs against previous time periods using trend analysis, providing additional context to performance data for successes and challenges, and using your peer network to track efforts and collaborative outcomes. Let's dig a little further into the E-MDT reporting systems, reports, and then their deadlines. There are two different platforms that grantees will be using for reporting. That's the PMT and the Just Grants platform. The PMT is a web-based reporting system which grantees can electronically submit qualitative and quantitative data. The Just Grant platform, though, is a grant management system that provides applicants and grantees with an end-to-end experience through key parts of the grant management lifecycle. For types, there are three different types of reports. The two different platforms, PMT and Just Grants, are responsible for different types of reports. The first report you see on the screen here is the quarterly performance measure report. This type of report is completed every 3 months and includes data on award activities, and it's entered into the PMT. The quarterly report is thought to be the numbers report, where this is mostly numerical data that will be shared in the PMT. The semi-annual narrative report is the second report that grantees are responsible for. In this report, in addition to the quarterly data reporting, it includes narrative questions related to grantee and sub-grantee activities. Narrative questions cover progress towards goals and objectives. There are a separate set of questions in the PMT, and these questions cover the previous 6 months of grant activity, as well as the upcoming 6 months of grant activity. And the closeout and final report should be completed at the end of the award, when you reach your end date or whenever you've expended all of your OVC funds. You will be responsible for a final report. This report includes aggregate of qualitative and quantitative data over the life cycle of the award. There's a set of narrative questions that each grantee will be answering that speak to the entirety of the award, not only to a semi-annual period as the other reports would have. The reporting schedule we follow follows the federal fiscal year, which starts on October 1st and ends on September 30th. It has 4 different quarters for reporting. As you see on the screen here, every 3 months a quarter closes. So October 1st to December 31st is the first quarter, and grantees are required to complete their performance measure reporting by January 30th. At the end of the close of a quarter, grantees always have 30 days to complete reporting. Because we have 2 different types of reports, there are quarterly reports that grantees must complete every quarter and semi-annual reports that are due every 6 months. You will see on the screen here which quarters require that semi-annual piece. Quarters 1 and quarter 3 require the narrative questions, which means those are the semi-annual reporting periods. In the right-hand column, there's a requirement to complete these and upload those semi-annual reports, the narrative reports, into Just Grants by the end of the reporting period. And that's for this current reporting period of January and then again in July. Grantees are responsible for submitting data through Just Grants platforms once the report is completed in the PMT. You'll also see that the last reporting period on the screen again, is for final reporting. This is after the end date has been reached for an award and the grantee is in the closeout process. The last reporting period is due within 120 days after an award ends, and grantees are responsible for completing narrative questions that speak to the entirety of that award. Reporting, though, is required for each quarter, even if there's been no grant activity. Once you have a start date and that has been reached and you've started to oversee the award, you're required to report every reporting period. Whether you've had an approved budget, whether there's been grant activity performed or not, you're still required to enter that data into the system. OVC identified training, collaborative partnerships, victim services, and strategic planning for E-MDT grantees to report on. The performance data reported by grantees allows OVC the ability to showcase the activities being conducted to support victims of crime, respond to data requests, and follow the progress that grantees are making towards achieving their goals. We're going to move over into tracking and reporting data, but I do want to just remind everyone, if you have any questions regarding the PMT, reporting, due dates, or any of that, please don't hesitate to put that in the chat box. Only OVC funded grant activities under the E-MDT award should be reported in the PMT. So if your organization receives other OVC grant awards or grants from federal, state, or local organizations, the work being conducted should be separated by funding stream. If you cannot separate activity by funding stream, data will need to be prorated. To do that, you must ensure that you have a system to delineate activities so that the data reported is not duplicative across multiple awards. We can help you with this at the PMT Help Desk. Please just give us a call, shoot us an email, something like that, and we can work with you. To document or to track the activities we are reporting on, we're going to break it down into the 4 categories. First, we have training. We need to make sure that we're documenting or collecting data on the date of the training, but the topics, the invitee list, as well as a list of those who attended. Any meeting with partners that is attended, we need to also collect that date of the meeting, the attendance for the meeting, that meeting agenda, and any notes that were taken during the meeting. To track deliverables for outreach and community events, we do need a little more detail. We need to make sure we're including the dates that the deliverables were initiated and completed, any invitations that were sent, how many participated, and a list of dates for any activities that are applicable that apply to those community outreach events. As we move down to the last column, providing services to individuals, we want to understand the program goals, have any intake forms and case notes. These need to be in the client files with dates, as well as any referrals that were made for that client to or from any other organization. In addition to reporting on the performance measures that are required by OVC, your organization or program may also benefit from collecting other performance metrics. As you dig deeper into looking at that, these are some questions that you may want to ask. Is your organization asked for specific pieces of information on a regular basis that this grant-funded program could help inform? Does your organization want to capture additional information to further showcase the impact of the program? Or are there any additional data points that can be used to highlight the need for the program within the community and make a case for future funding? It's important to always review the data prior to it being submitted, but here's a list of questions that we commonly get at the help desk that come up as errors. First, was the report completed and submitted on time? Should any notes be included in the additional comments box? Is the data in line with the program's funding amount, the goals and objectives, and staffing? Were there any illogical responses? How does this quarter's data compare to last quarter or even to last year? If your organization received a data verification notice during a previous quarter, does that data point appear to be accurate this quarter? Should any victimization types that's described as other be reported in any existing victimization category? And do your narrative responses accurately capture the progress made towards the goals and objectives? To collect data, to collect and store data, we will want to use some sort of tool consistently to make sure that we are collecting the data across staffing changes or making sure that that process is seamless in case there is staff turnover or something changes internally. I'm going to ask a poll, and Marty, are we polling this or am I asking it?
They were going to put their responses in the chat.
Just wanted to make sure. What is your organization's current progress for tracking and reporting performance data? Go ahead and throw that answer in the chat box. In the chat, we have many grantees use Excel, some sort of generalized form. Okay. Let's flip over to the performance management tools. Oh, somebody says they have a case referral and tracking form. There's not a one-size-fits-all recommendation for what tool to use. However, there are several case management systems available. To figure out which is best for you, determine the need of your organization. That's usually based on cost, capability, security, and what kinds of data it can collect. Digging through those 4 bullet points of things to consider when we're looking for a project management tool, we want to look at cost. Cost really affects whether it's a one-time flat fee or a monthly payment. This will be the case management software because it does cost money to have. We want to make sure that our organization is able to pay for that cost of the software, not just one time, but long-term. We want to see what capabilities does your organization need in a case management system. Does it need tracking abilities via multiple funding streams or multiple user access? Does the software ensure that any possibly identifiable information remains secure and confidential? And then data. Can the software aggregate the performance data as required by OVC or any other funding agency? This is an example of a resource that's been developed by the OVC PMT team that supports case management of victim services. It's a spreadsheet, obviously. It offers columns, quarterly tabs, and formulas for data collection, and it supports grantees with tracking grant activities for the Victim Services Question Bank. You can download this from the OVC site. I know the PowerPoint is getting sent out, and these are hyperlinked in. I'm going to turn it over to Phillip now for some other tools that he wanted to discuss.
Thank you, Kristin. So again, my name is Phillip Kim, and I'm the Technical Assistance Program Coordinator for the National Center at Weill Cornell Medicine. One of my first roles at Cornell was actually to help facilitate the E-MDT meetings in New York City. So I'm very familiar with, the PMT reports and the difficulties of documenting our work. Whether that's keeping tabs on who signed a confidentiality agreement, right, MOUs, tracking attendance for MDT meetings, and, trying to keep tabs on everything all at the same time. I understand the complexity of it all. Kristin mentioned some factors to consider when looking for a case management system, and I completely agree with everything she said. You have to obviously consider costs, right? You have to consider if the management system has all or, most of the capabilities and functionalities that you need. And the system has to be secure, right? Because we're dealing with case-sensitive information, and we need to be compliant with, all different kinds of regulations. And lastly, is the data easily extractable, right, for PMT reports? And can I actually utilize the data to derive actionable insights for my program? So I've used a lot of different tools and applications, and I've implemented different software tech for various nonprofits and their initiatives. One of the applications I came across that I found really useful for MDTs was a cloud-based application called Airtable. And I'm not endorsing Airtable in any way, but there are many different tools out there. But this is the one I've utilized, and I actually created a demo E-MDT database for us today to kind of showcase just one example, of how a smart case management system can really optimize and enhance your EMDT with, the built-in workflows and different automations. And also, you have the ability to quickly extract that data. So I'm going to share my screen. This is can everyone see that? All right. This is the EMDT database. Give me 1 second. Let me all right. Yeah, so as you can see, it's very familiar to an Excel spreadsheet, right? I've heard Airtable described as a spreadsheet with superpowers. So you have the different tabs on top, and within each tab, there are different records of data. And each column, right, has a specific field type. So like, there's your email, your phone number. This is a linked relationship. And so this is internal staff for, your internal contacts. This tab is for your partners, right? These are the people that you work with, the social workers that you work with, maybe people from APS. And again, you have their full name, titles, their contact information, so you can quickly contact them. You can start to see, because this database is relational, you can start to see, which EMDT meetings they've attended, did they sign a confidentiality agreement, which trainings have they attended, and all the partners may not be MDT members, right? So you can create like a checkbox to differentiate members who are part of the team and not. And then, obviously just keeping the list active and updated, right? So if someone retires or moves to a different organization, you can quickly toggle and say they're no longer active, right? So that's your partners, your organizations, right, is linked to the partners. So you have, and this is all a mock, right? So nothing's real here. This is all just a template. But like you have your organization name, I have it, different boroughs that each organization is a part of. You can see the different team members who's part of that organization, and you can see the type of organization that they are. Are they a government agency? Are they financial, legal, all that stuff? You can track their MOU documents here. And so, yeah, Airtable is very user-friendly. So you have some buttons on top here that you can utilize to manipulate your data to show what you want to see. So for example, right now, this is filtered and sorted by in alphabetical. So like, in alphabetical order. Let's say you want to group things, right? You want to group it by the borough. Then you can group it like that and see your data in this view. All the Manhattan organizations here, Queens, New York City. And another quick thing you can do is filtering, right? So let's say I want to see only the organizations that are part of law enforcement, right? So I can quickly put a filter and see all the law enforcement agencies. So that's just, some tools that you have with a smart relational database like this. Another thing Airtable has is the different views. So you can customize the view that you want. So let's say I want to see only Manhattan organizations, right? So I can quickly toggle to that view. And then I've already put that filter there. So it's only showing me Manhattan organizations. So again, Airtable, they give you the tools and functionalities to quickly, manipulate your data. So what I want to do now is I want to kind of take us through the life cycle of a case, right? So all the way from intake, when referral agencies submits a form, let's say to your MDT, from intake to consultation, right? And then maybe might go to an MDT meeting and then closing the case. So I'm going to take us through that whole process. All right. So how a case comes in, Airtable allows you to create customized forms. So I created this one for us today. There's the referral source information, right? They put their organization name, their name. They put their email, phone number, so you can contact them. And then they can put the client's information here, right? Their address, all that stuff, the city, borough, zip code. And then this is, I pulled all these from the demographics from the PMT report, right? So their gender, race and ethnicity. Do they have a special classification? You can check those, right? If they do. And then over here is where the referral agency would, write down a little bit of a case narrative, right? Another feature that you have for these forms is that you can kind of add helpful text. So this is what I added. Let's say you want to make sure that in this case narrative, they write something about the client's current living situation, right? Or you want specific information about the AA, or, what's the current status, right? Are there immediate safety concerns, right? What action steps have been taken so far? You can all write that in the case narrative. And then over here, you can select, the types of abuse that are going on. So this is a form that you can send to your MDT members so that they can submit, cases to you. And then, so once they click submit, this is going to auto-populate into your database, right? So we're going to take this example right here, FCA. It came from APS Manhattan North. Tony Smith was the case manager that referred this case. And this is the client's information, right? I have a formula field here looking at the date of birth to give you the age, current age, and all this information with that. And then this is the narrative, right? So we have a 78-year-old widow living alone. David Carter, he's the nephew, right? And he recently moved in to provide care. But, later we find from a concerned neighbor that, they found Evelyn Carter to be disheveled, bank statements, there's overdue on the table and whatnot, right? All these different things and signs of abuse. So a couple things that you can do with a smart system like this is that you can set up automation. So like I said, once the referral agency submits the form, we can have automation trigger that changes the status of this case, right, to open, let's say, right? Because we want to know all the cases that are open. Okay. Another automation that you can put here is, let's say I want to alert the E-MDT coordinator that someone just referred a case. What you can do is set up an automation where it sends an email to the E-MDT coordinator, right? And you can pull whatever information you want from this, from the form into that email and kind of create a custom email that says, at the top, this is who referred it, this is their contact information. Below, this is the client, this is the details of the case. And so you're alerted and you can quickly respond to and reach out to that agency. All right, so those are some of the automations that can take place. One other thing I want to talk about is if you see here, it says client intake PDF. Another cool feature that a smart relational database system can do is, let's say Airtable, one of the downsides of Airtable is that you can't generate custom PDFs, right? But Airtable you can use another application and integrate that application with Airtable to do that for you. So let's say you have an integration called Document. What it can do is it can pull all the information from the form and put it into a customized PDF that you may already have, right? You may already have a intake form that you send out to your MDT members to enter, but it can create that form for you here. So that's another nifty tool that Airtable can do. Okay, so you were alerted, right? As a coordinator, you got this case on your deck, and now you reach out. And so it's going to the consultation phase, right? So let's say sticking with FCA, right? Let's say you met with APS Manhattan North on 12/13. You discussed the case. You provided some follow-up steps, right? Some next steps, and you can keep track of that here as well. This is also from the PMT. All of these big, large selections have like 10 specific things underneath it. So you can keep track of that for the PMT here. And let's say you discussed it, and it's a complex case, so you want the forensic accountant on your MDT to review the bank statements, and you want the geropsychiatrist to do a psych eval because there's some cognitive issues there, right? And let's say you want to refer to a team, so I created a little checkbox here where you can select this, and what that will do is trigger another automation where now the client's case status is moved to new E-MDT case. Okay, and this is, again, there's different automations you can do, but this is kind of just to have something to track and be able to see where the case is in that life cycle, right? So, okay, now you referred the case to the MDT. So this is the MDT tab, right? You have your date of meeting. I have it split by the boroughs, right? I have it grouped as well. You have your coordinator. You have the clients discussed. So FCA, we decided that at the 1226 Manhattan E-MDT meeting, we're going to discuss FCA, right? And then here is a field where you can keep track of all the MDT members that attended, right? And then over here, you can put attachments for, let's say, your minutes to the meeting. And another tool that you can use on Airtable, a lot of these software applications, they're utilizing AI tools now, right? And so Airtable also adapted AI recently. So let's say you put the PDF of your minutes here, or Word doc, whatever, right, of your minutes. What I created here, this column is an AI column, right? It's a field type where I provided some prompt to it. So I said, read the notes from the meeting in the internal attachments, right? And pull out any action items and which person or organization is responsible for that action item. So instead of reading through, long pages of your minutes for your MDT meeting, you can use an AI tool to kind of pull out those action items that were discussed, right? Like we said, we would do a psych eval, we would do a home visit or whatever. And so I don't have that, here, but what it will show you here in this tab would be, all those action items and who is responsible for that. So as a coordinator, you can kind of quickly see that and then, send emails out to those people, right? If you don't know their emails, you can quickly go to partners and look for them. You can search their name or whatnot and find their email or phone number. So again, there's many different ways to go about this, but that's just another tool that you can possibly use. So, all right, now that the case was heard at the MDT, let's say you decided, okay, everything, risk was diminished and everything was solved or whatever. You want to change the case status to closed. There's many ways to do it, but let's just, for example, now it was a new MDT case. Now the case status is closed. So now what you might want to do, right, is gather feedback, right? You just, a referral was made, it was brought to the team and it was heard and, we close out the case and maybe you want feedback for that. So you can set up an automation where when I change this case status to closed, it will send an email out to the social worker or partner agency, right? A link for a feedback survey, right? And you can measure whatever impact, like say, on a scale from 1 to 10, how satisfied were you with, what we were able to do with the MDT for your case, or any question that you really want to gain feedback for. So again, you can create a feedback survey tab. You can create a customized form for that and track all those feedback surveys on this tab. Okay. And so that is from start to finish, from intake to close case, right? How the full life cycle of how that would work. All right. Okay, I'm gonna pause here because I know I just said a lot of information. If there's any questions, feel free to, put them in the chat or whatnot.
Phil, there is a question in the chat.
Okay.
From Mackenzie, is there any way to be able to get a copy of this demo template? It would be extremely helpful.
The demo template, I can pull out like a CSV file of it, but not necessarily like what you just saw. So I can share that CSV file for sure. And again, this is a demo, so nothing's complete. And you know, the examples are all, you know, mock examples. Thank you, Marty. All right, so the last thing I want to go over really quickly is another side of Airtable. So what you see here is the grid view, right? So all the little records of data. Airtable also has an interface view. And so I'm going to go to that right now. And so for PMT reports, right? You know, interface is where you can create custom dashboards that update in real time. So whatever you change in this view, right, and update here, it's going to be updated in your interface. So right now it's January, right? It's the narrative report is due by the end of this month. And so I'm going to do a little example, right? Right now, this is showing you the total clients that came in, right? The total client intakes. Let's do from the past reporting period. So this is a dashboard with different charts. And this filter button that I created, once I create this filter, it filters out all these different charts. So it's connected. All right. So date of intake is on 10/1, right? Because that was the last reporting period. And then date of intake is before January 1st. All right. So when I do that, it's going to filter out for that reporting period. So I can quickly see, okay, there were 3 case intakes, right? Clients that came in. All of them were for Manhattan. You know, there was 1 Hispanic Latino elder and then 2 white Caucasian, right? And then I could see the gender, right? I could see the special classifications. I can see the types of elder abuse that came in for this reporting period. And let's say you want to see a grid view, right, of your data, like how I showed you before. In this grid view, I hid certain fields to really just showcase exactly what you need for the PMT. So for the PMT report, right, this is, again, filtered for the last reporting period from October to January. And these are the different clients, right? Their age, their ethnicity, their demographics, special classifications, and all that is there. So that's just one example of, you know, I'm going to stop sharing my screen now. But yeah, that's just one example of pulling numbers for the PMT, right? I didn't even go over training yet or different outreach events that you may do. So, you know, a smart database system for your MDT can potentially, you know, save you a lot of time by utilizing different automations and AI tools. And you also have the ability to quickly organize, right, with those features of filtering, sorting, grouping, to quickly organize and manipulate your data for your reports and to derive insights. So that's all from me. I'm going to actually pass this back to Kristin to close this out.
Sorry about that, guys. I was muted. Okay, so thank you so much for all of that. Some resources and supports that we can provide over back with the PMT is if you need a quick answer, give us a call the PMT help desk. We have resources on OVC performance measures on our webpage. It has a list of all the performance measures, user guides for how to use the PMT in OVC dictionary, as well as online pre-recorded trainings. If you have other questions that require more time than just a quick answer, you can contact the help desk to receive any assistance with data entry. Schedule a welcome to OVC performance management session for new staff or for staff turnover. Email the help desk with any questions about a specific measure or even just to do a 30-minute technical assistance via WebEx for your reports. And on this slide we have, sorry. And on this side, we have the contact information for the OVC Help Desk as well as the Just Grants Help Desk. Again, this is all going to be sent out at the end of the session with the hyperlinks and the phone numbers and the times and all of that. But if you want to take a quick screenshot of that or take a picture, jot it down, it's here. And we are always happy to help. We really appreciate you and all of the work that you do. So thank you so much for your attendance today and your session. And I'll turn it back over to Marty.
Thank you. So yes, as Kristin said, I will be sending out the slides, but I also copied and pasted all the resources that were put into the chat by Maribel Fernandez. So that's all going to be in the email also. So you have all the information. I'd like to take a few minutes to gather. Well, first, before we do that, let me just ask, is there any questions for Phil or Kristin? First. I see a couple questions were answered in the chat already. Thank you, Kylan. Yes, there is a cost to Airtable, but it really depends upon what plan you get. And the center is definitely available to you for technical assistance on this template idea that Phil has outlined for you. But
And Mackenzie's asking if they should report on any case that's discussed in the MDT, even if it's not a full review. Sometimes the multiple cases are mentioned, references to how to approach a case. So that's a question that I don't know if Kristin, you want to speak to that, or if you want us to.
Sure. I think it really just depends on the instance. I don't think we can make a overreaching decision on that. I think that if you do have a question on how something should be reported, give us a call and we can hear a little bit more about what the instance is. Because I do think it just depends on the case.
So I'll circle back to something you said earlier and remind folks that they want to be consistent. So if you're going to highlight all of the cases that were discussed, make sure you do that each time, not, 1 month share all the cases, even partials, and then the next month only do the full discussion ones. You want to be consistent in that and make sure your data matches on that. I did have a question from a grantee this week about whether or not they could address a case that involved someone who was 56, who had full capacity but was being abused, and whether or not the EMDT could report that. And I told them that they could not count it to their grant numbers because it doesn't fall into the parameter of the scope of the work, but their EMDT could certainly have that conversation.
And Lisa, just to add to that, I think it might be helpful also to, if you're tracking those numbers, to include them in the narrative that gives the funders a sense of, the totality of your work as well, and areas where there isn't coverage for funding, but it gives them some sense of what directions to take if needed.
Hi, this is Mackenzie. I was the one who had asked the question. I'm wondering if I could just elaborate a little bit.
Go for it.
Okay, so I guess we don't have like super specific case reviews. A lot of times it's jumping around from different MDT members who are sharing similar circumstances they've had. Like if someone's dealing with a case that has multiple victimization aspects, another member might share a case that they also had that was similar to that, and how they responded to the different victimizations. So I'm wondering if you would only count the main case, or if you'd count all of the cases that were discussed, if that makes sense.
Is that question a PMT question? Are you asking, should each case be reported or should it? Yeah, so I think what I think it depends on what, like Lisa had said, what has been consistently done previously. If you're reporting on all of them, then you should report on all of them. But we do want to make sure that they're not duplicative. So we're not duplicating the reporting either.
So I guess my team hasn't known how to respond to those, so they haven't been reporting it. So I want to make sure I'm reporting it correctly because I was just recently onboarded. So it would be a new approach moving forward.
And to Grace's point, Mackenzie, what you'd want to think about is in the narrative, when you're talking about your meetings, make sure you say that the agencies share examples from other cases outside of the current one that the team is discussing
Okay,
in a way that keeps the confidentiality clear.
sure.
Mackenzie, one of the ways that we've approached that in New York, on our New York City teams is to think about, has the case moved forward as a result of the team meeting? So if there's progress and movement on a particular case, it's moved the case forward. That indicates for us that there has been an intervention that has arisen out of the team meeting. So if in the case that you're sharing where we're referencing what they've done, but we're not touching that case in particular. It just is used as an example. Like on New York City side, we don't track those cases. It just gives us a sense that, so I think we're going back to what Lisa is saying, the consistency is important, but we've taken that decision in terms of aligning our practice with reporting.
That's really helpful. Thank you.
Very good question.
Any other questions? Phil, I love that form. Seems like you've got everything in one spot. It's really fabulous. Thank you. I'd like to run some polls just to get some feedback from you all. So if you could just stick with us for just a moment. I'm going to launch this poll. You could answer it for us. That would be great.
And we have no way to know who's answering the polls at all. So this is truly anonymous.
Thank you for adding that, Lisa. Okay, we have about 50% of the people have answered. Okay, I'm going to go on to the next poll. If you could answer this question, that would be great. Once again, it's anonymous. And finally, last question. Okay. Thank you for that. Now, while we were doing that, did anybody think of a question they thought, oh, I wish they had covered that? Anything you thought of? Well, you certainly know where to find us if something comes up while you're doing the reports. And And sometimes you don't know what questions you need to ask until you're actually doing it. So, so let us know if that happens. Any final thoughts, Phil or Kristin?
I just put in the chat our technical assistance and training request form. So, if you have if you would like TA around data collection or database management or any TA in general, you can use that form and to reach out to us.
And I also just wanted to add that Maribel put the help desk information in the chat box as well, so please feel free and reach out if you need anything.
Was that the help desk in her Monday through Friday, those hours, that was the help desk?
Yep, that's the PMT help desk.
Okay. I wanted to make sure I had it correct in my follow-up email to everybody. Okay, great. Well, thank you so much for joining us today. Have a good rest of your day.
Thank you.
Bye, everyone.
Thank y'all.